In this video, we're going to talk about the most common skin cancer in the UK and also across Europe. I'm going to show you how they look like and what we do in dermatology in the UK. And hopefully you'll find this useful and educational. This is something I typically do on a day-to-day basis in clinic, and the things I say in this video is essentially the things that I would say in front of my patients as well. If you're wondering what they are, fret no more. Now they are basal cell carcinomas. They are also known as rodent ulcers and are pretty harmless actually because they rarely spread to surrounding areas compared to other skin cancers we have out there. Basal cell carcinomas typically happen after chronic sun exposure, either from direct sunlight or using sunbeds. They tend to affect fair-skinned individuals and are more prone on sun-exposed sites such as the scalp, the face, the ears and the neck. They are not infectious or hereditary, which means they can't be passed on from one generation to another. In very rare occasion, there is a genetic condition called Gorlin syndrome where patients are predisposed to lots and lots of basal cell carcinomas or BCCs in short. These patients also tend to develop other medical problems alongside BCCs, such as jaw cysts, larger bone structures, and pits on the palms and soles of the feet. Patients typically become aware of them as a non-healing lesion that refuses to clear. They tend to describe the lesion as a scab that doesn't really heal, sometimes can cause discomfort and can even bleed at times. Now, BCCs can look quite different depending on the subtypes, but the most classic type is the nodular BCC. And in nodular BCCs, you can appreciate a nodule that is irregularly shaped. There is a rolled, shiny edge as well as a central crust or ulcer. And if you magnify it using a magnifying light or a dermatoscope, you can sometimes appreciate these little blood vessels, also known as uprising vessels, that would branch out to form little tiny vessels on the surface. This is classic for a nodular BCC. Now, there are various other subtypes such as superficial, basal squamous, and morphic subtypes. These subtypes can look quite different from the classic nodular BCC, and they can sometimes mimic other skin conditions like eczema and psoriasis. And as such, this is where we come in as dermatologists because we will be able to differentiate using a dermatoscope the various subtypes. The most common and effective treatment is by far surgery, which is done under local anesthetic. And this means cutting the lesion out with some clear skin around it. The surrounding skin will then be stitched up using stitches, but sometimes for larger wound defects, we may then consider putting in a skin graft. Now, we have this specialized service in dermatology called the MOHS surgery. This is done in stages or in one visit where we cut the lesion out, have a look under the microscope in real time, and then go back in to take more skin out if there is tumor detected at the margins. The process is then repeated a few times until all the BCC is removed. Now, this is actually quite useful in treating BCCs that are complex, especially in difficult anatomical sites such as the ears and the face. Doing this will allow us to take the affected skin and leave the normal skin as much as possible behind to ensure a good cosmetic outcome. However, this is often quite time-consuming and should only be undertaken if a simple procedure is not suitable. The wound itself will typically be closed using a skin graft. Other treatments would include things like topical creams like Eldara and Affidix, freezing therapy, also known as cryotherapy, and a much less invasive procedure called CURETTAGE and CAUTERY. What this means is that we would shave the lesion off and then burn off any bleeding point using an electrical device called a hyfrecator. Radiotherapy can also be done, which is where we shine X-rays onto affected skin, and this is normally for patients who are not suitable for conventional surgery. Sometimes we use light treatment, also known as PDT, which stands for photodynamic therapy. In this case, we put a special cream to the affected skin, where the cream is absorbed by the cells of the BCC and subsequently destroyed by a specific wavelength of ultraviolet radiation. Lastly, there's a new medication called vismodegib. This is a type of medication that has recently become available in the UK for treating very complex BCCs, such as locally advanced BCCs that have spread to surrounding areas of the body. And there you have it. This is a short summary of basal cell carcinomas, also known as rodent ulcers. I hope you find this video useful. If you like watching this video, do check out my other videos as well in my channel. Thank you for watching once again. See you next time. Bye bye.